Next assessment is tandem walking, assessed at 5 years old or above. The base of support is seen at the plantar aspects of the bilateral feet. There is a trunk stabilization, contraction of hip flexors, abductors, adductors, quadriceps, hip extensors, as weight is transferred. This allows for rehearsal of higher level of gross motor play skills. The child may initially place the swing foot slightly in front of the stance foot, moving it posterior into the appropriate position only after stance has been initiated. Increased trunk sway for balance maintenance is seen, as well as arms positioned away from the body. Next assessment activity for toddlers is stair walking upstairs. So this is assessed at 24 to 29 months. So the base of support is at the bilateral plantar aspects of the feet. So we can observe that there is contraction of the abdominals, back extensors, dorsiflexors, hip flexors, abductors, gluteals, quadriceps, ankle plantar flexors. So initially the child may use the rail or adult support as the leg is brought to the upper step. A lateral trunk lean to the opposite side may be seen. As the child matures, weight will be maintained over the single limb with forward trunk lean as ascending begins. Next assessment activity is stair walking downstairs. So this is assessed at 36 to 41 months. The base of support will be seen at the bilateral plantar aspects of the feet. There is also a muscle activity at the contraction of gluteals, hip flexors, abductors, quadriceps, and plantar flexors. So initially the child may turn sideways toward the lead limb. So the base of support is widened to the length of the foot as the lead limb steps down. Next assessment activity would be ball throwing overhead. This is assessed at 2 to 4 years old. So the weight bearing or base of support will be seen on both feet. So there is a muscle activity on the shoulder flexors, adductors, elbow flexors, co-contraction of abdominals and back extensors, shoulder extensors, elbow extensors, and wrist flexors. So this has a functional activity of a playing skill. So feet may be side by side, staggered, or increase weight bearing on dominant foot. As the child becomes more proficient, movement can be more forceful and ballistic, and you may begin to see ulnar deviation. Next, we're going to assess ball throwing in one hand. So this is assessed at 43 to 53 months. So the base of support is on the plantar aspects of the feet bilaterally. Foot on throwing side slightly posterior. Weight is transferred from posterior foot to anterior foot with follow through. So there is a muscle activity on the hand intrinsics during the gripping of the ball, contraction of the rotator cuff muscles, biceps, shoulder flexors, abductors, gluteals, and the throwing arm. So there is also a contraction of triceps, wrist flexors, and obliques during the action phase. So it has a functional activity of upper level ball skill. So initially the child stands with feet side by side. The base of support is widened. There is little or no trunk rotation. The toddler age, the arm is thrown upward with little or no elbow flexion. During the acceleration phase, The arm remains extended with no wrist flexion. Trunk flexion may be seen as the ball is thrown. Next activity to assess is the prehension. First is palmar prehension or palmar supinate. This is assessed at 12 to 18 months. So the hand position is held in a fisted hand. The wrist is slightly flexed and the forearm is supinated from mid position. So the shoulder musculature active through flexion and extension with some horizontal adduction and abduction during this activity. The next activity to assess is prehension digital pronate. So this is assessed at 2 to 3 years old. The hand position is held with fingers and wrist is lunarly deviated ulit. Next activity to assess is prehension digital pronate. So this is assessed at 2 to 3 years old. The hand position writing implement is held with fingers. Wrist is ulnarly deviated and slightly extended. Forearm is slightly pronated. The muscle activity seen in this activity is shoulder stabilization, contraction of biceps and triceps, wrist stabilization by forearm musculature. Last activity to assess is dynamic tripod. This is assessed at 4.5 to 6 years old. So the hand position is in writing implement, held distally with precise opposition of distal phalanges of thumb and index and middle fingers. Ring and little fingers are flexed to fully form a stable support structure. The wrist is slightly extended. Metacarpophalangeal joints are stabilized during fine localized movement of the proximal interphalangeal joints. So there would be a contraction of wrist extensors, MCP joints, flexor digitorum longus, extensor digitorum longus, thumb adductors, and flexor hallucis longus.